The direction's good, but just with a little more caution, a little more hesitation.
The province has been removing key COVID-19 measures, including vaccine passports, capacity limits, and soon masks. Now come loosened isolation guidelines for close contacts.
The guidelines are being updated to minimize the burden on workers and families while ensuring our highest risk settings continue to be protected.
Here's what you need to know. Regardless of vaccination status, there are no isolation requirements for people who have had a close contact with someone outside their household. Instead, for 10 days, the province says to self-monitor for symptoms, to wear a mask and avoid activities where mask removal would be necessary, and not to visit anyone who is at higher risk of illness, including seniors. Also advising close contacts not to visit or work in highest risk settings unless they have tested positive in the past 90 days.
These requirements for masking or of recovering cases and contacts still apply when there are no longer masking requirements in the general community. If you have symptoms of COVID-19, you still need to isolate right away and get tested via a PCR if eligible or rapid antigen test.
If you have had a close contact in your household, you also have to follow those rules, but there are no self-isolation requirements for household members who previously tested positive in the past 90 days, those 18 or older who've received a booster dose, and those under 18 who are fully vaccinated.
These household members still need to wear a mask outside the house and avoid vulnerable people in high-risk settings like long-term care homes for 10 days, but they can continue to go into work and or school as long as they're asymptomatic.
But if you're a household member who isn't vaccinated and hasn't recently tested positive, then you are required to self-isolate. Meanwhile, guidelines for those who are immunocompromised is that they should isolate for 10 days, but follow additional precautions like masking for another 10 days.
We still have to be conscious of those people and protecting them as much as possible. But that level of protection is now moving from the general community and the government measures to an individual decision-making perspective.
Some experts say all of this comes too soon.
This virus has given us curveballs, it's given us strange twists and uncertainties for 2 years. We can't ever underestimate this thing.
Another expert adds that we're coming to a point of having to learn how to live with the virus, but we're still in a transition period.
In some ways, it's not an exact science. It's really sort of a bit of trial and error, and so I think that's why they're sort of saying, well, this is the next measure on that we want to sort of ease off on. But if things go differently in regard to the trend, we might have to re-implement something.
The province says the availability of rapid tests and high vaccination rates have allowed for these changes, but a reminder that this pandemic is far from over.
We've got a new variant appearing on our midst. It's a subvariant of Omicron called BA2, and that seems to be able to spread even faster than the existing one.
In Toronto, I'm Faiza Amin for City News.